Doctors/medical examiners/morticians of Reddit. What is the weirdest anomaly you've ever found on/in a body? Young man comes in complaining of headache. I work in radiology. We ask for history. Nothing to report. He says. We scan his head. Court shows a bullet rattling loose inside his sphenoid sinus, kind of between the nasal cavity and the brain. I asked the guy, have you ever been shot in the face? Oh, yeah. I guess I forgot to mention that. Father owns a crematory. We once cremated a man, with no clothes, and not in any container, and along with his ashes came a massive belt buckle. I kid you not. We have no idea how it got in him, but it was definitely there. Pretty memorable to me. I'm a doctor, was working in anesthesiology. An emergency came in the afternoon. Apparently the patient is a fisherman, and got into a fight with his fisherman friend. Patient was impaled by a spear gun. The spear entered just lateral to his belly button, and came out just above his right hip. He actually held this 6 feet long spear going through his body, and walked into the emergency room by himself. When it was time to put him under, he wasn't scared/anxious. He said, just fix me up, so I can go find that guy. One of our cadavers had two spinal cords. Split spinal cord malformation. She isn't dead, but this week I saw a patient with endometriosis in her lungs. Somehow, womb lining cells had traveled to her thorax and colonized on the lung. She previously had symptoms of coughing up blood while menstruating, but because the endometriosis was so severe, was on the pill to stop her periods entirely. Then she came off it to have a baby, and after the birth, with her hormones all over the place, she developed 2 pulmonary embolisms, blood clots in the lung, and a few weeks after that, 3 successive pneumothorax, collapsed lung. The womb cells had tried to shed, and made a hole between the airways and the sac surrounding the lung, letting air escape. She's deciding now whether to let the surgeons cut out the part of her lung with the endometrial cells, to go back on the pill for life, or to have a full hysterectomy and remove her ovaries. Tough choice at 32. Weirdest thing was in a woman's intestine, a dead mouse. Tiny little thing. Obviously never got the chance to ask how the mouse got there, as this was post-mortem. Definitely unexpected though. I was a combat medic in the army. Not super uncommon. About 1 in 10,000 people have it. But I had a buddy with situs inversus. All of his major internal organs were reversed. Heart on the right side instead of the left. For example, as soon as he got to the unit, it was the first thing he told me. Wanted to make sure if he got hurt. I wasn't curious as to why he had no heart, I guess. My colleague was embalming an autopsied male and found 2 hairnets, numerous plastic tissue sample slides, a plastic urine container with another person's name on it, and over 27 latex gloves within his abdominal cavity. Doctor here. General Prack and young. So not many experiences. I had this kid, 8, and his mother come to the petridge about a cold. As soon they came in, they filled the room with stench, like a wound festering. That humid and rancid smell. Kid had a runny nose, but secretions were coming from a single nostril. Upon examination we found the sinusal cavities filled with cotton. Apparently the kid had this funny idea of stuffing one nostril with cotton and shoving it up inside with a stick as far as he could. We had to call the specialist to remove a lot of very deep cotton. That was of course a picnic field for bacteria. Kid probably isn't going college, but he won't be lacking new ideas. I'm a funeral director. I haven't seen anything too anatomically weird, but I did have an innocent seeming old man with a tattoo on his shaft. Also, we had an obese woman, and when we were embalming/bathing her, a sugar pocket fell out of a fat roll. Just one of those little pink ones. It seemed like it had been in there for a while. In my anatomy lab, my group's cadaver had died from systemic complications of stage 4 lung cancer, and when we got to the lungs they were too rock hard. Necrotic blackened masses that looked nothing like the other cadaver's pink and spongy lungs. My anatomy prof took one lung out and wrung it, resulting in this putrid black goo flowing out of the lung. As he was draining the lung, he mentioned in an Indian accent, This is what happens when you smoke." Not a doctor, but my brother and I were the first for my mom's doctor. My brother and I are twins, but I was born a month premature. My brother was actually a few days overdue. My mom got pregnant with my brother and a month or so later she got pregnant with me. Her body released another egg despite her already being pregnant. Because of the way we were conceived, my brother shoved me up under our mom's ribs. Her heartbeat concealed mine. So a month before my brother's due date the doctor finally realized that there were two of us. This was in 1985. Ultrasounds weren't nearly as good as they are now. Here's another weird one. 3 golf balls in a man's stomach. His cause of death was lung cancer. Still trying to figure out how he ate golf balls / how long they were in there considering he was on life support for 2 weeks before he died. A real grub inside a tooth. An old patient came to us with a long-term and several pain in her tooth. The doctor extracted the tooth and put it into a tray. After 1 minute, we saw a grub crawling out from the tooth. This woman had lived with it for at least 6 months. Heard a story from a urologist when I was in medical school about a guy who came in for a vasectomy. During the procedure, the urologist has trouble finding the vas deferens, so he orders a few tests. Turns out the guy has bilateral congenital absence of the vas deferens, CAVD, but the guy had 3 kids. I've told this story on Reddit before, but I think on my other account. I worked in medicine as an x-ray tech/medical assistant. One day we had a patient come in complaining of a stomach ache. Considering the time of the year, it wasn't an abnormal complaint to have come in our family practice. So we run him through the normal test urinalysis and an abdominal x-ray cub for those medically inclined. Well, he was a shorter fella, so I had a lot of room on the film. This kind of x-ray is one large shot centered on your belly button. It's mostly used to see how full of crap you are. I went to the darkroom to process his film when something weird could be seen near his butt. There was definitely a lot of poop backed up, but I couldn't tell what was causing the blockage. I showed the doc the film and she busted out laughing. The doctor I worked with was usually stone-faced and serious about these kinds of things. So it was odd. We were all confused. She asked me to go into the room with her while she asked him some questions. The first thing she asked him was what he shoved up his butt. I was so taken aback by this statement I almost missed what he said. You see, this 40-year-old man has diarrhea the week before and decided to shove a tampon up his, but to stop it, he tried to take it out, but the string got caught, and then he simply forgot about it. We had to remove it. It was disgusting, and I never did another procedure ever again. Neurologist here. We don't get as many cool stories as the docs. However, when I was a medical student we had a cadaver with a very large and very tiger-striped tattooed being. This was the only tattoo this man had, and was very unexpected when it came time to genital dissection. Obviously, this was saved by the staff for use on all of our anatomy exams. You walk around the room to different parts/bodies and identify whatever is tagged. And this specimen was always identifiable by the only laughing medical student as they kept rotating around the room. Alas, man comes in after a car accident. We do a brain scan for safety and find a 3-inch nail embedded in his brain. Ask man about it. He says he has no idea, admits he was once shot with a nail gun, but had no idea a nail had been lodged in his head, had been there for well over 4 years. I was a mortician for a religious organization. And I have to say that the butt plug conundrum of 2013 was among the more difficult issues I've faced in the field. A decedent arrived in my morgue with a bejeweled butt plug firmly in place within the rectum, which led to a very interesting issue. If the family had known that the deceased was likely to have had such an item, we'd be screwed if we didn't list it amongst personal effects to be returned to the family. But if they were as vanilla as most of the relevant religious community claimed to be, such an item would probably be considered a slanderous perversion. Fortunately, my boss was a member of the relevant clergy, so I simply removed the item and popped it into a biohazard bag for him to decide upon. ICU nurse here had to prep a patient with a rectal vaginostomosis, a connection between the vag and rectum. Every time I would insert the enema into her rectum, all the crap water would come out of her vag. I honestly don't know if this is my weirdest, but it's the first that comes to mind. Had a kid. Anus imperforate. Not that uncommon. Basically, his intestines ended in a blind pouch. What was odd though, is that his genitals were rotated. When you took off his diaper, the scrotum sat on top. The peen was under it, pointing back. A fair number of cloverleaf head kids. An omphalical that contained all of the large intestine, the liver, part of the small, and part of a lung. Theatre nurse here. Probably not too weird, but we started a gastric sleeve on a huge woman. Stuck the camera in, and she was riddled with cancer. Really weird, she had no symptoms. She ended up losing all her weight without the sleeve. Did an autopsy once where the patient's plasma separated from the blood. One giant plasma ball. It was really weird. Not really fitting with the question posed, but a medical oddity just the same. My mother-in-law miscarried twice before she had my husband and his twin brother. She had some kind of cyst or protrusion in her uterus that once one of the previous fetus got to a certain week of growth, it would rub against the protrusion and rupture the sac, and the fetus would not be at a point of viability and would perish. So when she became pregnant with twins, she knew inevitably she would sadly lose them at that stage. The time frame comes and goes. Fetuses are still okay and growing normally. Comes time to have them, early as with twins, and lo and behold, not only are they in the same amniotic sac, but the other twin sac is around the one they shared. They were double bubbled. They had twin transfusion syndrome. So no one at the time had a moment to think about it, life or death emergency at that time, but the fact that they were double wrapped is more than likely the only reason they made it that far. Both survived the twin transfusion, very rare in the early 80s for one, if not both to die. Just an amazing story, I think. I was a nurse for the year and a dude came in with a big vibrating toy stuck in his ass, and it was still on, and we had to wait for the batteries to die before we could even do anything. There were 2 big DD sized batteries. He was there for like 3 hours laying on a table ass vibrating. Teratoma consisting of a couple molars as an incidental finding in a pelvis X-ray. It was in the patient's uterus. Guy in his 20s who had an X-ray. It was discovered that the peg holding his head onto his body was congenitally absent, synsodontoid. It's probably a good thing he never played football. Guy came in for an outpatient MRI of his cervical spine. On the form, where it asks if he ever had any metal in his body, specifically asks if any injured by a metal object, he selected no. Same with the verbal questionnaire. Also we do a keyword search in the patient's heart chart for the term foreign body in case it's documented nothing came up. He lays down, and I start taking images while talking to him though the speaker. During one of the image sets he starts pounding on the inside of the scanner and screaming. Figured he was claustrophobic, so I stop the machine and get him out. Immediately he jumps up and starts talking nonsense and runs into the wall, screaming he needs to get away from the ocean. I call overhead for emergency room staff to come down, and security as he's flailing continues screaming and running into the wall. Before we restrained him, the staff rush down, and he's talking a mile a minute and explaining how he is inside of the poster of the beach that covers the entire wall in the room he's in. Scared out of his mind and hallucinating. Security restrains him, and he's taken down to get an X-ray of his skull. There was a BB in his frontal lobe. It had just enough ferrous metal left in it to travel a few millimeters in his brain. In the emergency department he kept trying to escape, and was very fast. While unrestrained he got up, somehow convinced the guard he was better. Patient bolted out of his room into the main hallway. A code was called for a lost patient. For over an hour nobody could find him, until a nurse looked into a large storage closet. Poor guy was found in a pool of blood. He crashed into a large mirror that was leaning on the wall, and had severe lacerations of his neck, face and arms. Efforts were made to transfuse him, but it was too late. Still haunts me how simple BB from 40 years earlier could do that. Discovered his brother accidentally shot him with a BB gun when they were kids. I'm a carer for the elderly at a hospital. A nurse asked me to help her insert a catheter into a lady with dementia. But when we propped her legs open there was a horrific smell and we could see something dark in the vagal cavity. It was a teddy bear. We think it was there a while. During an autopsy, we found a plastic shamrock that was about 3-4 inches big in some guy's stomach. Another guy had the biggest piece of steak in his throat. Cause of death was obviously choking. A physician and I think I've seen almost everything. Really, it's like anything anyone can think that is messed up they have come to see me in the Welded cock ring on for a week causing guy to lose his junk. Fingernail polish remover bottle in an 85-year-old man's ass that ended up causing him to get a colostomy. Multiple small vibrators on and active in a lady that said she couldn't reach it. Even a terrible case where I found a big ass square 6-volt battery in a woman's vag. She came in because she thought her pimp had put an oil can in her because black liquid was coming out. But turns out the moisture caused the battery to make connection and charred the inside of her to crisp. Interned with me, and we had a case where the death was very sudden. He didn't really complain about any pain or anything, and then was gone. We open him up, and there's blood behind a kidney, almost an entire liter of blood in the cavity, with no sign at all of internal bleeding. Doctor here. Guy came in and told me he stuck a giant Cuban cigar up his ballon knot because he had an itch in his intestine. Apparently, his wife usually does it, but she's out of town. A cardiac teratomus, tumors, with teeth/hair. Pretty gross. Another dude who was constantly putting screws up his urethra because it kept him hard. There are others. I'm lazy. Toots. Not in the base, but my granda went for an ultrasound at 80, his first. Turned out his liver was twice as big, only had one kidney, and his gallbladder and some intestines were all twisted and backwards. The doctors felt it should have caused problems earlier. They just removed his gall and some other stuff and he lived another 8 years. First year of veterinary school, we are required to do a dissection on a dog and can elect to do a cat as well. One of the groups in my class opened up the chest of this cat that had died of natural causes, only to see its heart completely swallowed up by the diaphragm. For those of you who don't know what I'm talking about, the diaphragm is a really thin muscle in your chest that is a main contributor to breathing. This cat was born with a hole in the diaphragm, hernia, and had proceeded to grow around the heart like a little tent, making the heart more pillar-shaped than heart shape, and somehow managed to live almost to adulthood. So basically, the heart was half in the chest and also half in the abdomen, just casually brushing against its liver. Not me, but my friends found a horseshoe kidney, basically one long kidney. In med school my anatomy group had trouble transecting the non-genital dissection day. Turns out the cadaver had a penile implant, 2 thick braided wires coated in plastic. We couldn't figure it out, but the instructor came by and recognized it immediately, liberating the shaft with a vigorous upward thrust and leaving the implant protruding from the pelvis. He also had some hernia mesh, but that was less interesting. Work in orthopedics. Kid had a fracture we reduced in office and splinted. After a few weeks with proper healing he's transitioned into a cast. Usually we see them every week and re-ray it to ensure no displacement. First week post-cast application the rays show 2 solid circular objects blocking the fracture. Turns out the 6-year-old was hiding 50 cents he stole and hid from his brother. Not crazy I know. Just always found it funny how far siblings go to piss off the other. In cadaver anatomy, the woman we dissected was just filled with tumors. That wasn't the way she died. One of her ovaries was basically entirely taken over by tumors. It was really odd to see, and odd that they had apparently never known/found out until after death. That was a big one. But there were so many weird small things that it makes you wonder what there is weird about your own body that you may never know. A mummified fetus. I was working in Africa and the usually very stoic Congolese surgeons called me into theater. Gagging the patient was an elderly woman with a protruding abdominal mass. When they opened it, they found that it was a long dead mummified fetus which as a result of an ectopic pregnancy, had somehow managed to both wall off after it died and somehow avoid killing the mother. Her body had encapsulated the alien tissue, and over the years, it had slowly eroded her anterior abdominal wall to the point where it finally caused her to have enough symptoms to get something done about it. It was horrific and the smell was worse. Happily, though, the patient survived the procedure and just left the surgical team with a memory. The list goes on, but recently saw a patient with a complaint of vaporizer cartridge stuck up his ass. Number vapinish. Not a pathologist, but I work in a coroner's office. On more than one occasion we have directed a post-mortem on someone who has died abroad, often due to heart-related issues. I once got a phone call from the pathologist after he had opened the body to examine the heart. This person died from a heart attack. Yes, apparently so. You want me to examine the heart? Yes please. Where is it? Some other countries routinely remove organs when they are determining a cause of death. Then the body is embalmed and sent back to their home country. We still often have to confirm the cause of death. So I've spent a lot of my time chasing missing organs around the world. My dad had a patient that slipped and fell on a whole mayonnaise jar. Siren Amelia, mermaid syndrome. Born about 5 months premature, she didn't make it, and she was brought down to the pathology lab for examination. A few years back I had a woman overdose by shoving 7 fentanyl patches inside of her vag. Every letter of the English alphabet tattooed on a piece of extra skin flapping on some chick's vag, hence the name. Intrathoracic kidney in the chest. I'm a paramedic. I had a 911 call for a woman with a quartz stone in her lady bits. During the ride to the hospital I asked why she put it up there. She said she hits it with her vibrator to add pleasure and every now and then I can't get it out. There is a great book out by Adam K. He talks about when he was a junior doctor, probably intern in the US and Canada. A lady come into emerg with severe burns in her vag. She had stuffed Christmas lights up and turned them on. Gives new meaning to the phrase she put the Christmas lights up herself. I work as a statistician in a major hospital, so I see and catalog a lot of weird things. Worst thing I'd seen was someone come in complaining of leg pain and showing signs of septic shock. After examination doctor orders scans and there's 2 metal rods, one in each leg, that weren't on their file. Turns out the patient has been to Asia to get a height altering surgery and the doctor had used items you'd pick up from the local hardware store to fix the bones after breaking. After extensive surgery patient lost the lower part of one leg and was lucky to keep the second. When I was working as an ICU nurse in San Diego, I took care of woman with Creutzfeldt-Jakob disease for a few days, the human version of mad cow disease. She was only 44 years old, lived in Mexico. Her husband was a butcher, and they owned a restaurant in Mexico. They had 3 daughters, 18, 22, and were a really lovely family. It was really sad. My heart broke for them. There was nothing that could be done. My unit had a strict no more than 2 visitors overnight policy. Even despite my pleas given the situation, she didn't have much time left. So I did what I hope someone would do for me. I told the family the bad news of the policy, and then gave them the good news that I would be pretending they were obeying it. As soon as my boss left, the family donated her brain to University of Wisconsin so they could study it. Not a medical professional, but I have one bit of background info for clarity. I was born with a potentially fatal kidney condition and had a few close calls in my childhood. By time I reached my teens, my doctors were really concerned that I would end up needing a kidney transplant before I even reached adulthood. Now my dad is a universal donor, so he volunteered to go ahead and give me one of his, if it would even give me a chance. Doctors were game, and he had to get examined and stuff only to find something really odd and kinda upsetting for both of us. Turns out that my dad was born with only one kidney, so that wasn't happening. Lucky for me, I ended up not needing a transplant anyways, but my dad was really upset about that for a while. Part with incredibly severe as his sacrum to the base of his skull, out to his shoulder, and all his ribs were essentially one bone. Imagine being trapped inside your own body, where if you trip you can literally break your neck, back, or ribs and die. And then to add to that, you can't move your head down to see where you are going, so you are limited by how far down your eyes can look. Oh, and your hips don't really work nor your knees, and you can't put your arms out for balance or to catch yourself. Again, without risk of breaking every bone in your body. Additionally, you can't sleep on your back because your chest can't expand because of ribs being one bone. So it feels like you're drowning if you're on your back for more than a minute or two, which during the entire time you are essentially a turtle on its back. You can barely touch your nose with one of your arms, while completely unable to externally rotate your arm at the shoulder. Guy was one of the nicest, funniest people I've ever met. Not me, but my boyfriend's mom is a doctor for people with special needs. One of her patients An older man with Down syndrome, among other diagnoses, appeared to have extreme abdominal pains that lasted 4 weeks. They did several tests and tried some medication, but the pain wouldn't stop. He also suffered from constipation and stopped eating altogether at some point. The source of his trouble remained a mystery for almost 2 weeks, and the doctors were starting to get desperate. Then suddenly one afternoon my boyfriend's mom got a call from her clinic. She's the head of the department, so they let her know when something important happens, while she's not on duty, that this man had finally been able to go to the toilet, and among some stool was a blue latex glove. Over the following days he passed about 20 of these in total, and he felt better and better and luckily started eating again. Most likely he had somehow been able to steal the gloves from the cleaning lady's cart and ate them without anybody knowing/seeing, causing the gloves to get stuck in his intestine while absorbing his digested food, filling up like little poop balloons in his stomach. This really is one of the weirdest stories I've ever heard, but my boyfriend's mom said he had been known for eating weird stuff. Like this one time he ate a t-shirt. Edit, TL. Dr. Man experiences abdominal pains, unable to crap and stops eating. After nearly 2 weeks of this, he starts crapping blue latex gloves filled with poop and feels fine again. When I was in med school, I had a 3Y/O girl come in for a checkup, was checking her heart, and it seemed a bit off. When I brought it up to the mother, she said that the girl had situs inversus totalis, or, in other words, all of her organs were on the opposite side of the body, including the heart. When I checked the right side of the child's chest, the PMI, point of maximal impulse, was normal and the heart sound was normal. What the kicker of this girl's condition was that not only was this a very rare condition, she was the only person in the world to have a particular mutation. In other words, her mutation was rare, even among other people with situs inversus totalis. Edit, the condition itself is not that rare, but the particular mutation the girl had is. Not a doctor/me. We had a car accident case with a single female driver in really bad condition. While being treated, it was discovered she had a very large purple vibrator inside of her. I believe it was still on. Not a doctor. I have a friend who has an amazing medical history. 3 types of DNA malformations. He was conceived in his mother's second much smaller womb. His mother didn't know until she was almost due, because the womb had nowhere to expand. His ligament on his left leg wrapped around his calf instead of going down to his toes. His left foot has 2 distinct forms of clubfoot. He has spina bifida. He has clean filters. He isn't 20th female or XY male. He was born with an extra vestigial kidney, the stuff that protects your spine. His is 10 times stronger due to his weird DNA. He is missing a vertebrae. He had an experimental spinal surgery which was tried only 7/8 times/cases. He was the only one to walk afterwards. He was given shots of testosterone as a teen to make him have a male puberty. Now many years later this has given him prostate cancer. Testosterone blockers have now meant his clean filters has decided he is woman and he now has boobs. He is okay with this, since he is a magician that also does bearded lady gigs. There's probably more to his medical history, but that's all I can genuinely remember right now. He has been to patient/doctor soirees, where he walks around talking to doctors about how his existence disproves their medical theorems lol. I'm a pathologist, and during training I was working with the local medical examiner and had a case of gunshot wound to the chest that penetrated the heart. However, no exit wound was found, and no bullet was recovered upon evaluation of the heart. An X-ray revealed bullet fragments within the major arterial vessels in the legs, which presumably occurred when the bullet, lodged in the ventricular spaces of the heart, was taken up by the last agonal circulatory heartbeats and carried down to the lower extremities via the aorta through to the femoral arteries.